This time is the most crucial it's been the entire year. In the spring, it was not that bad here. We had COVID cases, but it wasn't like you saw pictures of New York. Today we have 140 COVID patients in a 213-bed hospital. I think it's only going to get worse before it gets better.
We're going to get her in as soon as possible. Rosa? Right here.
Right here. Hey Rosa, what's going on with her?
She has problems breathing. She's not eating.
Do you know her medical problems at all?
She has diabetes, severe diabetes, and high blood pressure.
Rosa, how many days have you been feeling this way?
¿Cuántos días?
Yeah, and the garden.
Alright? She's doing better already, okay, from when she came in here, alright? Okay? You're okay. Take a deep breath. Okay, we're going to do everything we can. That's what I can promise you, okay? Okay.
Alright, Rosa, I'm going to put this one on, okay?
So that's a constant battle. We're doing that all day long, 24 hours a day. I think if you didn't take it seriously before, now is the time to take it seriously.
Code blue, ICU North, bed 18. Code blue, ICU North, bed 18. Code blue, ICU North, bed 18.
We had this built on Friday in anticipation of the surge continuing to peak, which on Sunday it got there.
Our ISO is overwhelmed with patients, so we're going to double bunk them in here.
Okay. Normally these patients would be in the ICU upstairs, but all of those beds are full. We created an additional 10 beds outside of the ICU. Those are all full. We have 6 more patients holding in the operating room. And then we can hold up to 24 more patients in this area. It is completely full right now. As soon as one goes out, another one comes in. They are all COVID positive, every single one of them.
So 1, 2. She's in 42. I need 2 now.
42. Okay.
I need 3 more dividers then, right?
Everyone's getting sick with COVID at the same time, so our staff are calling out faster than we can get staff in. We've received a couple traveler nurses from the state of California recently, which is wonderful. But the hard part is that everyone's fighting for the same resources at the same time. All of the hospitals in California are struggling. We have the medications we need that the FDA has approved. We have convalescent plasma for patients. We have all the things that we didn't have previously, and patients still. It is effective, but these patients are just sicker. I don't even know how to explain it. It seems that once we get folks on a ventilator, it is really hard to get them off.
Where's the A-line? Right over in this side.
Right there.
A-line's in the first.
Just keep it up.
He's a person, happens to be a neighbor of mine. We have had family friends here. We've had people that I've known, you know, some people succeed and some people, you know, unfortunately COVID is it's a tragic process. So I've seen approximately 10 people that I know or that are family friends or neighbors. Three unfortunately have passed. So 3, it's tough. It's tough seeing all that. There's a lot of weight on the shoulders that we all carry. It's depressing, but we're all hopeful. That's the thing I think that we all cling on to. Hope. I'm a religious man, so I pray. while I can. Go home to my family, and I look at them, and that's what brings me happiness. That's what gets me out of my little depression.
I'm very tired today. I don't even know what day in a row we've been working. I've been working 12, 15 hours every day, as we all have been. We're here on weekends, we're here on nights, we're watching over each other, but you know, we're pouring our hearts out to the patients and the staff. It's hard. I'm tired. Yeah. There's still a lot of misunderstanding potentially in the community about how it spreads, how people are getting it. I don't think they realize how hard it is for the families when you see them come in here and hold the hand of their loved one that's about to die. We have done a lot of work around vaccine planning, but also realistically, it's not going to be available to community members right away. This is going to take months. It's going to take months for it to get better. You need to wear your mask. You need to social distance. You need to wash your hands. You really need to follow the science and the guidelines that are being put forward. We as healthcare workers and caregivers are doing everything we can to keep people safe, to take care of them while they're here in the hospital. But if so many people come in and keep coming in like this, it worries me that we're not going to be able to keep you or any of your loved ones safe any longer.